It's been such a crazy journey, and learned so much more. So obviously I was in the hospital for 20 days. A lot happened there. Came out a week later. I went and got my stitches removed, and it appeared that that was probably maybe too soon, maybe not, but by the time I got home, my incision opened up a little hole. And that's amazing. It's actually quite fascinating what your body will do when your lymphatic system isn't working properly, because mine got damaged with radiation, so it's not working right. It's not doing what it's supposed to do. It's not pushing the fluids through like they're supposed to. And it opened up a little hole and started leaking out. So by the time I got home, I actually had to turn around and go back to the hospital because my whole bandage was covered, and it opened up at the bottom. I leaked out in my car and everywhere else. So that was that. They put in the Pico dressing, I think it's called, so that has a little pump and it drains and all that stuff. And I've been wearing that all week. Yesterday was my 6th day. If I wear my 2B compression dressing on my leg, then the liquid or the fluid doesn't come out as fast. It still comes out, but it's not crazy. It just comes out slightly. Yesterday I decided, because I haven't been swollen, like I can actually see my ankles. So yesterday I didn't put it on right away when I got up. I usually put it on as soon as I get ready and put it on. So I didn't. And within an hour, the whole dressing was filled with fluid and it started leaking out the bottom. So it had to be changed. So normally when that happens, you have to go back to the hospital and they put a new one on. I did call the hospital and I just changed it to one of my normal dressings, just to kind of keep it going. I went through 3 of those yesterday. That's how much it was coming out. So I went back there today and I had a lot of questions. Would it be better to put the actual drain tube with the little pouch back on? Are you going to stitch up my hole? Because it went from like a little bit over a pin size to almost a dime size of a hole in the back of my leg. Back on antibiotics, because those are done. And if it's leaking like this, you should have something, right? So I had quite a few questions, and this is what I learned. When you have a hole like that, it has to heal on its own. That's why you wear this dressing that helps suction the fluids out, but it also supposed to help it seal itself. So as long as your body is trying to get rid of the fluid and it keeps swimming, you have to keep wearing this. When it becomes clear that it's not leaking out as much, it should close itself. So who knows how long that will be, because it's coming out quite a bit. So I go in normally every week to change it, unless it fills up before then. And then I have to go in earlier, just call and go in, which is kind of a pain to have to keep driving back and forth, but it is what it is, right? Like, it's just fascinating what your body does to help you heal. So yeah, wouldn't sew it up because it needs to heal on its own. No point in putting the actual tube back in, because this is supposed to be doing its job. This is what it's supposed to do. So I should be okay. And back on antibiotics, definitely. But always ask those questions, right? Like, if you have questions, ask them when you go. I keep getting told that because of my lymphatic system being compromised, because radiation did so much damage inside my leg, the healing process is very slow. Radiation slows down healing. So this will take time and patience, really testing patience. The leg hurts. It actually, it hurts. The whole leg hurts. Actually, both my legs hurt. My feet hurt. It's really weird. But the right leg really does hurt. And it hurts in different places differently. And I still have the crazy hypersensitivity on my calf area, a certain part, not all of it, but there's a part that is like super hypersensitive. which is like, kind of crazy. So I have to be really careful with that. And then my feet, like the top of my feet, it's like my veins or tendons or something are irritated and hurt quite a bit. So it just takes time. It's going to take time to heal. And it definitely takes patience, something I don't have for something like this, which I'm learning to be more patient. I'm trying, getting there. My family is right on top of everything. If I'm doing too much, they're right on me. Around the house, I walk normally without anything, so without the walker, without the cane, because I've got things to grab onto if I have to. The leg is very weak, so it does give out sometimes, so I have to make sure like I'm walking close to walls so I can just grab onto something. If I do go out, if it's not very far, I know I'm in and out of something, I bring my cane. But if I do go out where I know it's a little further, I bring the walker because it has a seat, which is great idea, great invention. Didn't think I would ever need it or use it at the beginning, and I can't say enough about it right now. So definitely a good thing to have. But if you have questions, always ask them. It's never a stupid question. You could never have a stupid question because you just never know. And everybody's different. Things happen differently to everybody. And I think the medical system is learning themselves still because, right, everybody's reactions to things are different. So it's very well documented. And yeah, that's all you can do. But just stay on top of it. Thanks, Jess. Can't wait to meet your little baby there. Haven't seen him yet. So yeah, I just wanted to kind of put that out because there's always something to learn. I'm constantly learning so much information about this and learning about myself and how little patience I have for stuff like this and how much it takes to just function some days. Some days it's hard to get out of bed, like my leg is just exhausted. Nights aren't very pretty, but it's more like, it almost feels like I have a crazy leg, but it's not crazy leg. It's just so irritated. And if it's leaking more, then it's more irritated. So it's definitely been an adventure, definitely a lot of learning. And I also wanted to say thank you to everyone. I started doing these videos because I thought it was a great opportunity to share the information, learn from it. And it's become so much more. You guys have been phenomenal with all the positive messages and the prayers and everything. It's been absolutely amazing for me. So I really appreciate that. I can't keep saying that enough. So I just wanted to share this, and I hope you guys have an amazing day. It's beautiful outside. It is a little cloudy, but the sun is shining, and it's kind of a perfect be outside kind of day.